Your glutes are an incredibly important muscle when it comes to how you move, cycle, run, stand up, sit down, go up and down stairs. Unfortunately, like 80% of the clients that we see at the clinic who have problems with those movements or aches and pains in their legs, hips, and lower back have a glute activation problem. So, what is glute activation and what kinds of problems do we see it causing, and how do I know that it's glute activation that does it? So in this video, I'm going to talk about all those things so that you can get a better understanding of why glute activation is so important. And then in the next video, you can learn how to test it yourself. Hi, I'm Katherine. I'm the founder and principal therapist at Layton Sports Massage, and I love helping people live pain-free or as close to it as possible. So first of all, what is glute activation? When your brain sends a message to a muscle and that muscle contracts, the brain is activating that muscle. So that's when we say glute activation. When you pick something up, your brain is activating your bicep to pick that thing up, to bend your elbow. So your glutes should be active in all the movements that I mentioned in the intro. But unfortunately, for some reason, it's very commonly not being recruited in those movements. And it's crazy because I see people who can run 16 miles and they aren't using their glutes. And then we do glute activation with them and they come back and they say, my glutes are sore. It's the first time they've ever been sore. And it does cause a lot of problems. So if your brain isn't asking your glute to contract in movements, all the other muscles in your system, in your legs, in your hips, in your lower back, are having to work harder to compensate. And as you know, if you've ever had to pick up the slack for a lazy coworker, you can't keep doing that indefinitely without having some sort of problem. Or in the case of a lazy coworker, maybe imagining throwing a coffee cup at their head. Not that I condone violence, of course. So now that you know what glute activation is, I'd like to walk you through some of the common problems that we see and then explain why I think these things are related. Because do you ever watch those videos or read an article and go, okay, you're saying this, but how do you know? Like, how do you know it's glute activation and not any number of other things? But before I dive in, I just want to remind you that you should not use these videos as self-diagnosis tools. They can give you some hints about how your body works, and the better you know about your body, the better equipped you are to manage yourself. But if you have a specific problem or ache or pain, you're best seeing a professional who has the qualification and knowledge to look at all of your details and help you figure out what the right solution is for you. So please take this as information only purposes. Please don't use this as a diagnostic tool for yourself. So your glutes are there to stabilize your pelvis and keep your femur, your thigh bone, in place. They're the muscle at the back of the hips. Basically, they're your butt muscles. Now, when you stand up, sit down, walk, run, swim, cycle, any kind of movement with your legs, your glutes should be involved. If they're not, your calves have to compensate, your quads have to compensate, and your hamstrings have to compensate. Let alone, there's a muscle that's deep in the hip called the piriformis that is also compensating to stabilize the thigh bone in your pelvis, in your hip. So what happens when the hamstrings get really tight and the quads get really tight, and then the IT bands join in and the calves join in with being overactive and overcompensating? So tight hamstrings, everybody knows about hamstring injuries, can also give you pain on the sides of the knee where they attach. Quads being tight seem to compress the knee because when we release the quads, the knee feels better. IT band, a lot of runners are going to be familiar with that. If the IT band is trying to stabilize the femur because the glutes aren't doing it, if we stand forward of our body, stand forward of our feet, the whole back line has to overwork. Our calves are taking most of the brunt of bending our ankles, which can create calf problems, Achilles problems, and even sometimes be a factor in plantar fasciitis. Just to recap of the problems that I just said, it's knee pain, hip pain, hamstring tension, quad tension, IT band problems, calf problems, and we can also get it for lower back, which I didn't say the first time around. So how do I know that glutes are related to this? So a couple things usually happen. One of two things usually happen. Either I see somebody who's already been to 3 or 4 people. So they've been to physios and osteos and various people. And they've had them do everything but glute activation. They've had them do stretching. They've had them strengthen their quads, strengthen their hamstrings, strengthen their calves, stretch their hamstrings, stretch their quads, foam roll all the IT band painfully. And they didn't get better. And I assess their glute activation, find their glutes aren't working. And in doing the glute activation, they get better. The other thing that happens is we'll get people coming in and they've got knee pain on one side and they don't have knee pain on the other side. And when we look at their mechanics, one of the things that consistently comes up is that the glute's not activating on the side that has the problem. And we get the glute activating on the side that has the problem. And the problem gets less. Yes, we still have to stretch the muscles out. Yes, sometimes we have to strengthen other muscles. But if you're not addressing the fact that the glutes aren't pulling their weight, you don't get that lasting benefit that we do when we do incorporate glute activation in the protocol that we use with people. And I've been doing this for 10 years, and this is repeatedly the case. And I know that there are other practitioners who do glute activation with their clients. Now, you might be thinking, my glutes must work because I do lots of glute strengthening, like squats and lunges and the glute bridges and Superman and all of these things. Here's the thing though. If your brain is not asking your glute to contract when you do the movement, you're not using your glutes and you're actually straining your other muscles. One of my very first clear-cut glute activation cases was a man who cycled to and from work every day. He ran 3 times a week. He swam twice a week. He did glute bridges. He did squats. He did lunges. But when we actually tested to see if he could contract both of his glutes, he couldn't contract one of them. And that was the one that had the hamstring problem on it. So don't keep doing strengthening exercises for glutes unless you know that glute activation is one of your issues. Now, I'm really interested, out of all the things that I've listed as a problem, do you have any of those? Or have you ever had any of those? Like, is this something you're like, oh, I have had knee pain, or my hamstrings do seem to be really tight? Like, if that's you, please stick a comment below, because I'd love to know, out of everyone who's watching, who has what, and like what is kind of like, oh yeah, that's me, or what's not me, because then I know what to do more videos on, right? If you want to test your glutes, that is our next video. In the next video, I'm going to show you 3 super easy ways on how to test your glutes and see if they're activating. If you're pretty sure that you have a glute activation problem and you want help, stay tuned. I'm going to be doing more videos on that. But also, we run a glute activation workshop. So if you're in London, you can come to them. As of recording, our next one is the 10th of November, 2019 in Leighton. But if you're watching after this, I'll put the link for the workshops in like the description for this video, so you can just click and see what we have scheduled coming up. And there is a way to get on a wait list to be notified. If you know anyone who has any of the problems that I've listed and think maybe they'd like to know about glute activation, please share this video and like this video so more people can see it. And if you'd like to keep up to date with our videos, click subscribe and you'll be notified as we release a new video every week. Thanks so much for watching, and I'll see you in the next video.